talking about some pretty fundamental change, but we've got this plan. So I think you've both already answered some of the specifics. I want to put to you both, because this is, I suppose the phrase jumps out, war rooms, obviously dreamed up in some politician's mind, perhaps, about managing demand and availability, looking at spare hospital beds and ambulances and things like that. But I think you've already both answered that, because it's no good looking for spare capacity if there just isn't any, Dr. Browne.
Yeah, absolutely. I mean, I just want to also thank Dr. Pollock for all her work for the NHS. She's just an amazing advocate, and I would recommend reading her book, NHS PLC, because it's so insightful and completely just honest, and as many people that needs to read it as possible. In terms of what you're saying, yeah, who is going to staff these hubs? I mean, I think what's going to be interesting is the information from the hubs. I don't know whether that will immediately help us, but I think it will kind of confirm a postcode lottery. But already in terms of just vacancies, we've got 10% of vacancies mostly in London, and then you've got sort of 6% in Yorkshire. So if people were redistributed, I don't think it's going to make a significant difference or a long-term difference. So we want a long-term difference. We want an interest in sustaining the NHS, and not just having, like we were talking about, a two-tier system where you can get a limited amount of the care, and then otherwise you then have to sort of wait for it or pay for it, which is what we're seeing. And it is really, really worrying. And also in terms of workforce, the government has just decided on the 4th of October to basically make it much harder for international graduates to work in the NHS when we absolutely need as much workforce as possible. So I really would appeal to them to rethink that, because you do need actual people to staff these amazing plans that you're coming up with. And I would also appeal to try and make it not reactive and actually think about long-term things. So the CDC during COVID asking for better ventilation in hospitals to reduce respiratory tract infections. And also, you know, in terms of retaining staff, the staff that you need to see people and to have the right qualifications to see people, you know, we're losing them in droves. It's really, really worrying. And in terms of acute care for winter, which is what we're focusing on at the moment, you know, you have consultants at the moment. The BMA has come out with about, you know, a huge number of consultants thinking about leaving this year. And if you look at the Nuffield statistics in the acute fields, acute physicians are finding that they've got sort of 60% of vacancies. So this is a real issue, and we've got to get responsibility about the workforce environment if we're going to have viable plans.
Well, let's get some of Professor Pollock's some thoughts on that, on staff retention, because I suppose it's a vicious cycle. As the pressures build, more staff get burnt out, they leave, and those that are left have to work even harder and get even more burnt out. How do you address that? How do you stop that happening?
Yes, and